Very much delighted to be part of a very interesting and powerful panel of women who have a vision of what needs to be done in order to play a critical role, but also a meaningful role in society. Let me take this opportunity, of course, and acknowledge my panelists, my fellow panelists, but also take this opportunity to acknowledge the guests, in particular my colleague, the Consul General of Sri Lanka, as well as my other colleagues who are diplomats in South African Consulate, and everybody else that came here from different walks of life who are going to be giving us an audience. Let me also thank ORF for taking this initiative and inviting us to come and play a role in just giving our view of what needs to be done or what could be done. I will be concentrating much on the reproductive system hygiene. I don't know, this doesn't sound so well. Can you hear me? Okay. The reproductive system and the hygiene part of it that we need to look at, because I think it starts there. I am not a professional health caregiver, but I'm a woman, but I'm also working with human beings as a Consul General, but I'm also an activist in my own right, in particular a gender activist. So that's the little background that I have. One of the things that, or one of the things that made some of us to want to really talk about the issue of maternal health, but in particular the hygiene and the issue of distribution or free access or easy access to sanitary towels for women of childbearing age, is precisely because out of the 8 Sustainable Development Goals, I do believe that 7 of those goals speak to this particular issue. And the reason I'm saying that is because if you then now talk about no poverty, making sure that we are going to create a society where there's no poverty, you cannot speak about that without having to talk about the issue of reproductive system, in particular the campaign that I think all of us need to start initiating wherever we are in terms of access to sanitary towels. I know it might sound like something that not everybody wants to hear, but it becomes important. Most of the people that are suffering or don't have access to sanitary towels are people who are living in abject poverty. So that's one of the things that we really have to look at, because once you cannot be able to afford food or you cannot be able to afford accommodation, just think about access to sanitary towels. Zero hunger as well, of course, food is a basic need, so that the sanitary towels become something that people don't even think of. Good health and well-being. This is the reason where I would then now say that the hygienic part of this thing that I'm talking about will definitely speak to the issues of preventing diseases such as cancer, especially cervical cancer, yeast infection, hepatitis, and all the other diseases that are unnecessary, that can be preventable if we do look at the issue of hygiene and the usage or easy access to sanitary towels. Quality education. People can ask, what does education have to do with access to sanitary towels? It has been proven, I might not have exact statistics, but most young girls that go to school do drop out of school precisely because at the time when they go to their menstrual cycle and they don't have access to sanitary towels, they are unable to go to school. And that at some time it can take about missing school for 4 days to 7 days. They miss a lot. Some of them may not even be able to go back to school because of what they've missed or whatever it is that they may have gone through while they were going through their own cycle. So that affects access to education and making sure that we do offer quality education to everybody, irrespective of gender. Gender equality, I think this just speaks for itself. The reason I'm saying this is because if you have looked at the presentation that was made here, in particular in South Africa, In 1994, the percentage of HIV/AIDS infection was very high. However, through primary health care and of course the government of President Nelson Mandela, there was a concerted effort that was put in making sure that we don't only distribute ARVs and other medication, but we also play a big role in preventing the infection of HIV/AIDS. And that we did by making sure that in each and every clinic and public places, we do give out free condoms. I know maybe I shouldn't say, but I have to talk about this. However, some of the discussions that we've been having, especially from the gender activists, was saying that a young woman or any woman of childbearing age does not choose to go on their periods. But for you to get infections most of the time, not all the time, it is because you have to get involved in sexual intercourse, which is a choice. So if you give free condoms, but you don't give out free sanitary towels, what are you saying? On something that people don't choose on their own. So when you talk about gender equality, this also find itself having to be affected by talking about the issue of what comes first. How does gender get to be considered as government sit down and allocate resources for different issues? Sanitation, of course, we do know that hygiene has to do with sanitation as it is. So this is the reason that I was saying that out of the 8, 7 of the goals do speak to the issue of what we are talking about today. Decent work and economic growth, of course, also get affected because if children cannot go to school, young women in particular, and they don't get educated, they will not be able to contribute as productive forces as they grow older in order to participate in the economy. Recently, as a South African consulate, we participated in, I think it happens all the time when we do Nelson Mandela Day, which is something that we do every year on the 18th of July, because we call it Mandela Month. I think that is why also you'd find that we do give, the ORF gave a presentation on Mandela. Now on Mandela Day, what we usually do is that we go out on the 18th of July to do something for people who would never be able to repay you. So we have tried our best to make sure that we look at NGOs that deals with the issue of reproductive system, either in the prevention of cancer or free access to or easy access to sanitary towels. So the economic part that I wanted to talk about in terms of what could be done, not only on the matter of making sure that we prevent cancer and so forth and so on, but in terms of economic emancipation. We have tried to go around and look at ways in which women themselves can be able to produce sanitary towels for sale, for selling to their own people around where they are staying. So if we do invest together in making sure that we participate in getting access to sanitary towels to young women, but also preventing the diseases that comes with it, I do believe that we would have started with the issue of maternal health, because I do believe it starts there. Because to become a mother, you have to go through this process first. That is why it is very important. Now, some of the things that we can do is to also go out and educate young women, educate men as well, about what is this particular system that is actually responsible for all of us being here. Because that is the start of life. Because most of the time, two people do believe that you are dirty or there's something wrong with you, which is not necessarily the case. And sometimes people think it is a taboo to talk about menstrual cycle, which is very important that we talk about this, because it is not something that we should hide, but it is something that can be able to contribute to society if we handle everything else in the correct way. So that is just a little bit of my interest or our interest and contribution as a consulate, or even myself as just a person that is an activist. So I think that there is a lot of things that could be done to be able to prevent cancer, but equally so to keep young women at school and also contribute to the economy by making sure that women become part of the value chain of the production of the towels that can be able to be distributed easily and in a cheaper way in society. So thank you.